Today's competency is local and systemic cardiovascular regulatory mechanism. This mechanism, cardiovascular regulatory mechanism, the purpose of the mechanism is to maintain adequate blood flow to the tissues. So, for that purpose, this regulatory mechanism is purpose to supply adequate blood to the tissues, to the organs, to the body. Whenever there is any change in blood flow to the organs, to the tissues, the body tries to maintain it. For the maintenance, this sort of maintenance, flow to the organs, to the tissues, throughout the body, there are two types of regulations. One is systemic regulation, another is local regulation. First, I will discuss about local regulations. Local regulations means the tissues, the part of an organ, the tissues, if the tissue finds or the organ finds that supply is too much, there is high pressure in the organ, in the tissues, it will try to reduce it. If it finds the supply of blood is less flow is there, so it will by itself try to maintain its flow. So it is the inherent mechanism, it is having the tissues, the organs are having their inherent mechanism by which they can control their blood supply, blood flow into them. So this is the local cardiovascular regulatory mechanisms. We'll discuss in detail about this. There are another mechanism, systemic regulation. That is regulation of blood flow, blood pressure, cardiac output throughout the body, not to a particular organ. So this has to supply blood adequately to different organs. So this is done by centrally by the mechanism called systemic regulations. Okay. So first, let us see what are local regulatory mechanisms. So local mechanisms are important, as I said, in regulating blood flow to the specific tissues. Local cardiovascular regulation refers to intrinsic ability of the tissues and organs to adjust their blood flow independently of systemic control. Without the control of the systemic control, they can, by themselves, they can control their blood supply. How this has been done by the local mechanisms? These are seen in what kind of tissues? These are vital organs. These sort of mechanisms are particularly evident in vital organs. So what are these vital organs? These are kidney, brain, heart, skeletal muscles, skin. So this sort of regulatory mechanism you will find, local regulatory mechanism you will find under local regulatory mechanism, okay, in these tissues. Whereas the systemic control, systemic regulatory mechanism is the systemic blood vascular cardiovascular regulatory mechanism ensures adequate blood flow and pressure throughout the body by coordinating neural, hormonal and local mechanisms. So systemic control will involve neural mechanism, hormonal mechanism and local element. That means it will also include the local mechanism. Without the local mechanism, they will require the service of the local mechanisms. So local mechanisms are also involved in systemic regulations. So mainly this will be done by the central mechanism in case of systemic control. And the control is, they will use two or three important things, 3-4 important things by which they will make this adjustment. One is heart, beating of the heart rate. They will affect the heart rate. In mechanism, we will find heart rate is controlled. If necessary, it will increase the heart rate. If necessary, it will decrease the heart rate. Thereby, it will control the cardiac output. Okay. Another thing is, we know the blood vessels, they are we call some vessels as resistant vessels. Why resistant vessels? These vessels are having smooth muscles. These vessels are having smooth muscles. And these smooth muscles can be contracted, can be relaxed. Thereby, we can decrease the diameter of the vessels, we can increase the diameter of the. When diameter is increased, blood flow will be increased. When diameter is decreased, blood flow will be decreased. So, by increasing and decreasing, the regulatory mechanism can increase the flow, can decrease the flow. So, it is their next thing by which they can control. Another thing is, we have seen, particularly in microcirculation, that the arterioles and meta-arterioles and the pre-capillary sphincters, they are very important. If necessary, they can contract. If arterioles are contract, less blood will be supplied to the tissues. If the sphincters are closed, no blood will be passing. If the sphincters are dilated, there will be more blood will be passing to the tissues. Okay, so by controlling the arteriole, by controlling the meta-arteriole, diameter of the meta-arteriole, by controlling the sphincters, we can control, the body can control the blood supply into the tissues. So particularly whenever adjustment will be required, they will affect the diameter of these four weapons. One is cardiac activity. This will be done by the central systemic mechanism. And the others, that is controlled, the contraction of the arteriole, contraction of the sphincters, contraction of the precapillary vessels, they are under the influence of neural influence, as well as they are under the influence of local chemicals, local hormones, metabolites. We will see this. So, systemic regulation is done, we can see, by nervous system, by the endocrine system, that is neural mechanism, hormonal mechanism, and by local mechanisms. Means they will produce some metabolites. These metabolites, when there is increased demand for oxygen, increased metabolism in the tissues, it will produce some metabolites. So these metabolites are vasodilator. These metabolites are vasodilator. For example, carbon dioxide, increased level of carbon dioxide, decreased oxygen level, or increased hydrogen ion concentration, increased lactic acid, increased adenosine. Okay, they are vasodilator. These metabolites are vasodilators. So when their production is increased, metabolic production is increased, there will be vasodilation. So there will be increased flow of blood into the tissues. So this is done by this mechanism. We will discuss later. And let us now understand the mechanism of what? Mechanism of local regulations. How local? So we will find two types of mechanism. One is short term, immediate. Another is long term. Long term is simple. It will cause angiogenesis. What is angiogenesis? Suppose this area has to be supplied with blood. Blood, it is not adequate. It is not adequate. So what has to be done? So it needs more capillaries. It needs more capillaries. So some capillaries will be formed from the venual end or from the arterial end. And this mechanism of angiogenesis, it is there in uterine cycle, in reproductive cycle of girls, in menstrual cycle, endometrium, there is angiogenesis. Okay, so this way, in heart, when there is infarction and some area is damaged because of the infection, so for survival of that area, some new vessels are generated. Angiogenesis is there, means new blood vessel formation is there. This is the long-term procedure. It needs time. Now, we'll discuss about the short-term regulator. Is that okay? What is the long-term procedure? Simply angiogenesis. Okay. When angiogenesis is, if some area is not getting adequate blood supply for long, for days after days, then what will happen? That area will get more capillaries from the existing venual or arteriole. Okay, so now there will be more blood supply. In that way, blood flow will be increased. Is that okay? Okay, fine. Next, now let us discuss about short-term regulations. Short-term regulations are made by whatever. Is it earthquake? No. Okay. So see, what is this regulatory mechanism? So one is local mechanism, another is systemic mechanism. Systemic mechanism is done by neural regulation and by hormonal or chemical regulation. Hormonal, there are two types group of hormones. The vasoconstrictor, they will cause vasoconstriction, by that they will increase the blood pressure, they will increase the blood supply. And here the decrease the blood supply. And these are the vasodilators. So they will dilate the blood vessels, so more blood supply will be there. So these are the we will discuss later. So now we are explaining this thing, local mechanism. So there are two type of mechanism, local mechanism. One is short term, another is long term. Long term is done by angiogenesis and short term is done by three mechanisms. One is myogenic theory or myogenic mechanism, and second one is what? Metabolic theory, means metabolites will be produced. That metabolites are usually vasodilator. So thereby it will increase, these metabolites can increase the blood supply to the tissues, to the organs. What are these metabolites? I just said, what are these metabolites? Increased carbon dioxide level in the tissues, or increased hydrogen ion concentration in the tissues, or increased lactic acid, or increased adenosine level, increased potassium ion also. So they are vasodilated, they will cause vasodilation and thereby it will increase the supply of blood into the organ. Okay, so this is the metabolic theory. Now I am coming into myogenic theory. Myogenic theory, where is the incidence going on? In the tissues, locally, in the organ, say in the kidney, or in the heart, or in the brain, some part of the brain. So these are those. So there, not throughout the body. So in that part, blood vessels are there. In that part, blood vessels are, and those vessels means arterioles are there, precapillary vessels are there, meta-arterioles are there. So their wall is having smooth muscles. The arterioles having smooth muscles, meta-arterioles also having, but very less. So since there is smooth muscle, they can contract, they can relax. And these muscles are always in a tone called sympathetic tone. As a result of this sympathetic tone, these muscles are normally remains into a contractile state, into a contractile state. Okay, as a result, these blood vessels are slightly narrowed. Okay, so this is called sympathetic tone. These smooth muscles of these vessels are always in a sympathetic tone, always in a mildly constricted state of constriction. Okay, so not only by sympathetic tone, also by another factor. What is this factor? We know some smooth muscles, as we have seen in GI tract, what some smooth muscles are having a unique property. What is that? They can produce their own impulse, own action potential. Interstitial cell of Kajal. Can you remember that? Interstitial cell of Kajals. So here the smooth muscles, some smooth muscles are also having interstitial cells of Kajal. So their inherent property is to produce impulse in the action potential spikes. So because of this phasic production of the spikes, there will be constriction of the smooth muscles and they will remain in a slightly contractile state. Okay, so if necessary, if I want to increase the flow, now I can influence this muscle to dilate since they are initially under slightly constricted state. So if necessary, I can dilate them. So when they will be dilated, flow will be increased. Or if necessary, I have to reduce the flow, then they are already constricted. Now again further constriction I can make. So as a result, what will happen? The area will get less blood supply. So by modifying, I can modify the diameter by constricting or by relaxing the smooth muscles. So this is the myogenic theory. What happens? Now let us assume blood pressure in this area or in this organ is increased. Pressure is increased. As a result, what will happen? The vessel will be dilated. Smooth muscles will be stretched. Now the smooth muscles are having receptors. Now because of the stretching, these receptors will be stimulated. Okay. Now what will happen? They will be stimulated. They will open the calcium channel. We know calcium is outside, is always in ECF it is higher concentration. Inside the cell it is less concentration. So what is happening? Again I am telling you. What is happening? Blood vessel is stretched because of increased blood pressure. There will be stretching of the wall in the arteriole. So muscle will be stressed. So stressing of the muscles will initiate opening of calcium channels. As a result, some calcium will be entering into the smooth muscle cell. So there will be smooth muscle contraction. So when the smooth muscles are contracted, blood vessel will be narrowed, will be or dilated. What will be there? Blood vessels. Here smooth muscles are there. Now blood pressure has increased. The wall will be dilated. So, and these smooth muscles, there will be stressing in the smooth muscles. And suppose this is the smooth muscles. So this will be stressed. Because of the stress, the calcium channel here will be opened. So calcium ion will be entering into the sarcoplasm from ECF. Okay? As a result, there will be contraction of the smooth muscles. Now smooth muscles are circularly arranged. So because of this contraction, what will happen? The lumen will be narrowed. So if lumen is narrowed, blood flow will be reduced. When it was dilated, more blood was passing. Now, because of more stretching, there will be stretching, increased stretching, stimulation of the smooth muscles, opening of the calcium channels, entry of calcium channel into the smooth muscle, constriction of the smooth muscles, narrowing of the smooth muscle, blood will be reduced. So this is the mechanism of myogenic theory. Okay? See the sequence. See the sequence. Note the sequence. Go through it. Increased blood pressure. Afferent arteriolar blood pressure will be increased. Arterial wall will be stretched because of that. Sensing by myogenic stress receptors. Then there will be opening of Burdis-gated sodium channels. Now what will happen? The calcium channels. Now calcium ion will enter into the smooth muscle from ECF into the cell. So what there will be constriction, contraction of the smooth muscle. So vessel will be constricted, blood will be reduced, pressure will be reduced. So this is the mechanism of called myogenic theory, control of blood flow by the myogenic mechanism. Okay, is that okay? Now, if blood pressure is reduced, that I have seen the condition when blood pressure is reduced. Now, if blood pressure is reduced, the earlier one, if the pressure is increased. Now, what is condition? If the pressure is reduced. Now, what happens if the pressure is reduced, arterial pressure is reduced? No, there will not be reduced stretching of blood vessels. So, cell calcium entry will be reduced. Intracellular calcium ion concentration will be reduced. Vascular resistance will be reduced. Vascular resistance will be, it was concentrated, now it will be relaxed, more blood will be flow. So as a result, what will happen? So because of reduced blood pressure, there was reduced blood flow. Now because of this mechanism, again blood flow will be increased plus. This has caused reduction in blood flow. Now this mechanism will cause increase in blood flow. Okay, this is the myogenic theory. Okay, let us see about the mechanism of local metabolism. I have already discussed, so I will not repeat this. Okay, these metabolites will affect these precapillary sphincters. The sphincters are always a little bit constricted state. Now they will dilate it, so more blood will be entering. Okay, so blood flow will be increased. So these are the things. What are these? Histamines. In allergic reactions, what happens? You have seen histamines released. There is swelling. Why swelling? There is the increase in blood flow. Why we increase in? Their blood vessels are dilated. And the membranes, endothelial cells, the gap between them is opened or became wider. So more fluid will be entering. So there will be swelling. There will be inflammations. Okay. So these are the mechanism. Now local vasodilator metabolites. Oh, these are the same thing. Now mechanism of by local hormones. So local hormones. This local hormone means the endothelial layer. Hello. The endothelial layer, they are also a little, you can say they are also endocrine gland. This endothelium, they can also secrete chemicals. They are called local hormones. Endothelin, one of the examples. From endothelin, we can get what we can get? Serotonin or 5-hydroxytryptamine. thromboxane A2. So they are vasoconstrictors. When blood supply has to be reduced, they will secrete from the endothelium. These local hormones will be secreted. They are vasoconstrictor. They will narrow the blood vessels. Those blood vessels, precapillary membrane sphincters, they will be contracted. So there will be less blood flow to the tissues. Okay. So, and there are also vasodilators. Nitric oxide. It is a very good vasodilator. Okay, so these are also produced from the endothelium, endothelial cells. So these nitric oxides from endothelial cells, also prostacyclin from endothelial cells, histamine, and vasodilator metabolites, they act as vasodilators. So these are the vasodilating local hormones, and those are vasoconstricting local hormones. So by them, they can, with the use of these local hormones, they can increase or decrease the blood flow. So when we need to increase the blood flow, we'll produce the vasodilators. When we want to decrease the blood flow, there will be secretion of vasoconstrictor local hormones. Okay, in this way we can control local blood supply, local blood pressure using these mechanisms. See, that means these areas, these organs, kidneys, brain, heart, skin, so they are having auto-regulating mechanism. Means when there is increased blood supply, they can reduce it. When there is reduced blood supply, they can increase it. Okay, let us see this picture. It's not very small. So how cardiac output, 5 liters of blood, they are distributed in different organs. Okay, and what is the flow rate? This is the flow rate. Now these flow rates can be adjusted. Suppose you started exercising or started using heavy brain activity, then what if they will require more blood supply? This supply 0.70 liter per minute, this is not adequate. Then I have to increase the supply. So from where you will get the additional blood flow, additional blood? This will be then, it will be reduced. Supply to this will be reduced. Supply to this will be reduced. So from this, extra blood will be sent to the brain or to the kidney. In this way, we can regulate automatically. This is called auto-regulation. When you will be studying the coronary circulation, you will find there is auto-regulation. You have to describe how blood flow is maintained through auto-regulation. In brain, coronary, cerebral circulation, there is also auto-regulation. In kidney, there is also auto-regulations. So when you will be studying those regional circulation, you have to mention, you have to explain those auto-regulating mechanisms. Now the long-term mechanisms, okay, very nice. Angiogenesis I have already taught. Okay, let us see the next part. Okay, what is systemic regulatory mechanism? Okay, I thought I will not be getting time, so I am having 20 minutes time. Very nice. So let us first discuss the second one, hormonal control. Very simple. When you get excited, we are having late night party, okay? Where is he? Late night party? Party wala? Okay. So what happens? Lot of excitement. Okay? You are watching match, cricket match. So lot of excitement. See what has happened when the Pakistanis see the India-Pakistan match. You see their excitement. Our excitement also very high. We were at the peak at the time. So that time, our sympathetic system is highly activated. It has increased the cardiac activity, increased the blood pressure. It has increased the secretion from suprarenal gland. What is this? Adrenal gland. Now this center part of the adrenal gland is what? Adrenal medulla. Adrenal medulla. And this adrenal medulla secretes adrenaline. So when there is lot of excitement, we say, I wasted lot of adrenaline. When there is excitement, means lot of adrenaline secretion from there. So now this adrenaline, noradrenaline is having effect. Their action is like sympathetic nervous system. Sympathetic nervous system, their nerve endings secrete adrenaline as well as noradrenaline. So their action, these are secreted from the nerve endings. But here they are not secreted from the nerve endings. They are directly secreted into the blood. Now when this blood with adrenaline secreted from adrenal gland will be coming to the heart, to the blood vessels, what will be there? Blood vessel, heart rate will be increased. There will be increased cardiac output. There will be increased force of stroke volume. So cardiac output will be increased. If there is increased cardiac, blood pressure will be increased. Okay. So in that way, adrenaline can increase the blood pressure. Okay. Also another hormone is there, thyroxine. Those who are having hyperthyroidism, so more general people say, I am having thyroid. You have heard this. Even some student told me that her mother or she is having or he is having thyroid. What does it mean? Does it make any sense? Everyone tells like that, isn't it? It doesn't make any sense. Either, actually, those patients are suffering from hypothyroidism. Their TSH level is high. Those patients, they are not producing adequate amount of T3, T4. So hypothalamus is trying, Are Baba, produce. I want more thyroxine. Producing. Again it is increasing TSH. To stimulate this, but it is unable to produce. So what will happen? In blood, TSH level will be high. So with this, when there is high, more than normal level of TSH, we call this condition hypothyroidism. T3, T4, its function is catabolic function, energy production, heat production in the body. Increased metabolism is going on during that part because of action of the T3, T4. So my body storage of carbohydrate, fat, these will be utilized, as well as there will be reduction in body weight. So those who are having hyperthyroidism, more production of T3, T4, they will be thin. Their body weight will be less because the hormones are utilizing all the body stores for production of energy. Okay, and the opposite happens in case of hypothyroidism. I am eating some food, but these food are not a part of this utilized for energy production, and most part is utilized in the adipose tissue. There these are stored. As a result, there will be weight gain. So there will be hypothyroid patients their body weight will be more. Okay. So these are the difference. So in hyperthyroidism, there will be increased secretion of thyroxine, and this thyroxine can increase the heart rate. If heart rate is increased, blood pressure will be increased. So they can increase the heart rate as well as blood flow to the organs by increasing the heart rate and blood flow. So epinephrine, norepinephrine, they can increase the blood pressure. Antidiuretic hormone, it is also called vasopressin. Vasopressin. That means they will increase the blood pressure. Okay, actually antidiuretic hormone, it increases water reabsorption. It increases water reabsorption. So if water from the urine is reabsorbed, from the filtrate, more water is reabsorbed, blood volume will be increased. Increased blood volume will cause increase in blood pressure. Okay, so aldosterone also also can increase the blood flow. How? Aldosterone's main function is to increase the sodium absorption from the renal tubule. So more sodium will be absorbed into the blood. You have filtered a lot of sodium ion through the glomerulus into the tubule. Now because of action of the aldosterone, this sodium ion again will be reabsorbed into the blood, but the sodium will not come alone. It will carry some water also with it. As a result, volume of blood will be increased, water is increased in the blood, so volume of blood will be increased and sodium is also increased. As a result, what will be happen? There will be increased blood pressure, increased cardiac output. So this way we can increase these hormones, can increase the cardiovascular, can affect cardiovascular mechanism. Atrial natriuretic, ANP, we also in short we call ANP, it decreases blood pressure. Okay, atrial in the heart, it is produced, particularly in atria. Aldosterone, angiotensins too. In the kidney, we have one mechanism, renin-angiotensin system. Everybody, this is important for your exam. Renin-angiotensin system of blood pressure regulation. In our next class, I will be discussing the blood pressure. Definitely, this will be there, renin-angiotensin system and kinin-bradykinin system. So these systems are important for your exam. Explain or explanatory. Explanation you needed, no? So write it down. These are important. So you have to study this. Angiotensin 2, this increases blood pressure. How? These angiotensin 2 are produced. So in the renal tubule, when efferent arteriole. So through efferent arteriole, if blood flow is reduced, so what will happen? There will be reduced production of urine, less blood is coming, less filtration will be there, less reabsorption will be there. So what to do? Some autoregulatory mechanism is there to increase the diameter. How it will do it? So this cell will produce one thing. When blood flow is reduced, this cell will produce one thing called renin. Now this renin enters into the blood, and this renin in the blood plasma, there is lot of globulins. One variety of globulin is alpha-2 globulin. These are nothing but it is angiotensinogen. This alpha-2 globulin is nothing but angiotensinogen. So now this renin will convert this angiotensinogen into angiotensin 1. Now this angiotensin 1 will be converted into angiotensin 2 by an enzyme which is present in lung capillaries. This blood will be passing, this angiotensin 1 through blood will be passing through the lung, but there is one enzyme. What is this? In the capillary there is one angiotensin converting enzyme. So now this angiotensin converting enzyme will convert angiotensin 1 into angiotensin 2, and this is a vasoconstrictor. And now this angiotensin will cause vasoconstriction. As a result, what will be there? There will be angiotensin there will be increase in blood pressure. There will be increase in blood pressure. So blood pressure in the afferent arteriole will be increased. So it was stimulate this thing happened. Why? Reduction in blood pressure in the afferent arteriole. Now because of this angiotensin II production, again there will be contraction in other area. So blood pressure will be increased. Now more blood will be passing to this afferent arteriole. So renal blood flow will be maintained. This way the renin angiotensin system also help in hormonal regulation of blood supply. Okay. In short, very short, neural control, it will involve central nervous system, means medulla oblongata. In medulla oblongata, medulla, there is one center called vasomotor center. This vasomotor center, this is medulla, nucleus tractus solitarius. These nucleus are very important for regulation of breathing, respiration. Regulation of respiration. Also they take part in regulation of cardiovascular function. Okay, so it is having dual function, dual control. Okay, and it is a very powerful. Okay, so all what is happening in the periphery, this information, particularly in blood pressure, blood flow, regarding this nucleus, NTS, it gets information from the periphery through afferent nerves, sensory nerve. And what are these two sensory nerves? There are two important sensory nerves. One is glossopharyngeal, 9th cranial nerve. Another is vagus or 10th cranial nerve. They give input to the NTS. According to this input, it modifies the center. It modifies the activity of the center. Okay. Now, in this area, they are having vasomotor VMC. In the vasomotor center, there is pressure area, deep pressure area. When you stimulate pressure area, blood pressure will be increased. When you stimulate deep pressure area, blood pressure will be reduced. Pressure area will increase blood pressure, increase heart rate, and deep pressure area will do the opposite. Pressure area, these are the nucleus tractus solitarius, pressure area, deep pressure area. These are the deep pressure area, this is the pressure area. How they will act? They will act through efferents. And they must have efferent part. That is, they must have some reflex part. Reflex part. This medullary system, this having actually controls all these functions by two mechanisms. One is afferent, one is by autonomic mechanism. One is sympathetic, another is parasympathetic. Okay, now let us see what is the parasympathetic part or sympathetic part. When blood pressure is increased, it will be sensed by baroreceptors because the vessels will be stretched. Now, they are safety valve, you can tell them. They will inform the brain, blood pressure is increased. That's why they are located here. What is this? This is the carotid nerve, and there is bifurcation. In the external, there will be a carotid sinus. There is a dilatation. In the wall of the carotid sinus, there are some receptors. We call it baroreceptors. So when blood pressure will be increased, these baroreceptors will be stimulated. Now these baroreceptors, stimulation from these baroreceptors are located in two sites. One is aorta, aortic arc, another is aortic carotid sinus. So both are having baroreceptors. Now when with increased blood pressure, aortic baroreceptors, carotid baroreceptors will be stimulated, and they will be going through carotid nerve. That from carotid baroreceptor impulse will be carried by this carotid sinus nerve. Then it will join the glossopharyngeal nerve, and they will enter into the NTS, nucleus tractus solitarius, through in medulla, and will end here in nucleus tractus solitarius. So it will stimulate the vagus nerve, that is nucleus ambiguous. So that is the NTS. It is the nucleus ambiguous from where vagus nerve is originated. So this will stimulate this. So vagus nerve through cardiac ganglia will enter into SA node of the heart. Okay, it will liberate acetylcholine, and we have seen in your practical exam acetylcholine reduces cardiac activity. So why they are stimulated? Because of increase in cardiac activity, increase in blood pressure. Okay, when there is increase in blood pressure, so through this path, this impulse will be coming to the NTS. From the NTS will stimulate this one, nucleus ambiguous. From this vagus nerve originates. Now the vagus nerve will end into the SA node, AV node, and atrial muscles, and they will cause reduction in heart rate, reduction in force of contraction, reduction in conductivity. As a result, what will happen? Cardiac activity reduced, blood pressure will be reduced. Okay. Now, near the carotid sinus, there is some other organ, or not organ, there is another tissue mass called carotid body. In the aortic arch also similar carotid bodies are there, So they are actually having chemoreceptors. So when blood supply is reduced, low blood pressure, there will be accumulation of metabolites, means there will be increased carbon dioxide level, decreased oxygen level, increased hydrogen ion concentration, increased lactate concentration in blood. They will cause stimulation of the carotid bodies. Now from this carotid body, again this impulse will be coming to the nucleus tractus solitarius. Now this nucleus tractus solitarius will cause inhibition of this center. So no inhibitory impulse will be coming to the SA node. So no acetylcholine. So as a result, heartbeat will be increased. At the same time, what will happen? It will cause stimulation of the pressure area in the medulla. This pressure area will stimulate the lateral horn cell of the spinal cord. Now this lateral horn cell of the spinal cord from these sympathetic nerves will be coming and supply to the heart, and this will increase adrenaline, noradrenaline from its noradrenaline. As a result, cardiac activity will be increased. So when these chemoreceptors are stimulated, reflexively what is done? There is increase in heart rate, increase in blood pressure. They also cause constriction of the blood vessels. So constriction of the blood pressure will increase the blood pressure, and increase in cardiac activity, heart rate will also cause increase in blood pressure. So now there will not be any accumulated amount, and everything will be washed away. So no more impulse to the chemoreceptors. So as a result, again the blood pressure will be coming to the normal state. In this way, it is maintained. Okay. Important, this chemical neural regulation, it can be asked for as long question. Prepare it. Again, I am telling you, prepare it as long questions for heart rate regulation, also for blood pressure regulation. We'll discuss in our next class. These are very important. And also two other important, and another thing I will write, buffer nerves, right? Buffer nerves. What are buffer nerves?